I'm here to introduce our first speaker, Doctor Armaiti May. Dr. May is a house call veterinarian with a practice in the West Los Angeles area. She has an impressive list of credentials. A graduate of UC Berkeley, she received her Doctor of Veterinary Medicine from UC Davis. She spent 2 years working as a 24-hour dog and cat emergency hospital, and she's also certified in veterinary acupuncture. Not just a friend to dogs and cats, Dr. May is also a supporter of vegan outreach and humane education, a member of the Humane Society Veterinary Medicine Association, and on the board of United Animal Nations. Today, Dr. May is here to teach us all how we can keep our animal companions healthy. So please join me in welcoming Dr. Armaiti May.
Thank you, Jessica. Thank you all for coming today. I'm very happy to be here and sharing this wonderful occasion with you all. So what I'm going to be talking about is how to keep your companion animals healthy, and I'll be giving a broad overview of several topics that I think are important in keeping animals healthy. I'll start off with discussing vaccinations, some of the things to be aware of with that. Then I'll talk a little bit about socialization and why that's important. Then I'll discuss spaying and neutering. And finally, I'll finish up with some toxin exposure avoidance tips, as well as things to consider about diet for your companion animal. Now, vaccines can be a blessing or a curse. I've definitely seen dogs and cats suffer because of diseases they acquired because they were not vaccinated, infectious diseases. And I've also seen cases where dogs and cats were harmed as a result of a vaccine that they received, or possibly multiple vaccines. So it's important to navigate through these decisions carefully, and I'm going to provide some guidelines that hopefully will help you with that. When it comes to dogs, there are basically two core vaccines that they really have to get. One is rabies, which is required by law, and the other one is called DHPP, which stands for distemper, hepatitis, parvovirus, parainfluenza. It's a 4-in-1 vaccine. And that one is important to prevent infectious disease. However, sometimes it can be given too frequently. It can also be given too infrequently. The ideal schedule is 1 booster at 8, 12, and 16 weeks of age, followed by a 1-year booster, and then after that, every 3 years. A lot of veterinarians actually give the vaccine on a yearly basis instead of every 3 years, but in the last several years, the more recent recommendations have been to space them out. And this helps to prevent certain undesirable side effects that can occur later in life, including autoimmune disease, especially in dogs. And that is a canine vaccine. I'm going to be talking a little bit about some of the problems that can happen with cat or feline vaccines in a little bit. But one of the conflicts surrounding this issue has to do with the fact that the manufacturers of the vaccines stand to profit from selling more of their product. So if they label them with 1-year usage labels, then they'll sell more of their product, but that's not necessarily in the best interest of your dog. The other things to keep in mind are not every dog needs every single vaccine. For example, a dog that's living in the city that doesn't have exposure to wild animals or ticks really doesn't need the Lyme disease vaccine, which protects against a tick-borne disease called Lyme disease. And rattlesnake vaccine, again, is something that's only really indicated for a dog who's likely to encounter rattlesnakes. The leptospirosis vaccine is yet another what is called non-core vaccine, and that protects against a disease that can be transmitted from wildlife. So unless a dog's living in the country or going camping, hiking, where he or she may encounter wildlife, there's really no need for that vaccine to be given. One of the more common non-core vaccines is actually Bordetella, which is to protect against kennel cough. And that one is indicated if the dog's going to be around other dogs frequently, such as going to dog parks, kennels, boarding facilities, grooming facilities, and so forth. But if that's not the case, then there really isn't need for that one either. Now I'm going to talk a little bit about feline vaccines of interest. The main core feline vaccination is FVRCP. That stands for feline viral rhinotracheitis and calicivirus, and it protects against the main viral diseases that can be quite severe for cats. And that should be given at 8 and 12 weeks of age, and then again boosted a year later, and then every 3 years after that. And just like the DHPP vaccine for dogs, there are a lot of veterinarians who do give it on a yearly basis. But recently, in the last number of years, it's been discovered that there's a tumor called a fibrosarcoma that has been associated with this particular type of vaccine. Well, usually a certain type of vaccine, but that has led to different recommendations, spacing them out less often. And so instead of every year, some of the organizations are recommending every 3 years on that as well. And then the other non-core vaccines for cats would be FELV, or feline leukemia, and that's really only indicated if the cat's going to be outdoors around other cats and exposed to that. So I've talked about selection of vaccines, so that's one aspect of vaccine safety, is being really prudent in figuring out which vaccines are going to have your pet receive. Now another thing is the frequency, and on a more immediate level, as far as preventing immediate adverse effects, another helpful tip is to space out the vaccines by at least 2 weeks if your pet is going to receive more than a couple vaccines at a time. I've definitely seen many cases where dogs get adverse vaccine reactions, and it can be as mild as hives, which are just bumpy swellings over the surface of the skin, and it can be as severe as a full-on anaphylactic shock. And while those are treatable, it's better to prevent them if we can, and so it's better to actually just give no more than 1 or 2 vaccines at a given visit, and then wait 2 to 3 weeks before giving any more vaccines. Another vaccine that is frequently used but really isn't necessary is coronavirus vaccine. It's supposedly to protect against the coronavirus disease, which is very rare for one thing, and is also very mild and can be resolved on its own. So there's really no reason to vaccinate for that, and that's a dog vaccine. So now I'm going to talk a little bit about socialization and behavior training, and that's actually really important because behavior problems constitute the #1 reason why dogs and cats are relinquished to shelters in the United States, and that's basically the #1 cause of death, more than all of the medical problems put together when you think about it, because that's the #1 reason why they're relinquished to shelters. So it's really important to prevent problems by having proper behavior training and socialization early in life. And this can be accomplished through exposing your dog to lots of different people, to other dogs, although before the full vaccines have been given, there may be a window of vulnerability to diseases, and so that has to be navigated more carefully. But certainly exposure to healthy adult vaccinated dogs is great. And once they've had their vaccines, enrolling them in puppy classes so they learn to interact properly with other dogs. It's very important. There's a great book that I recommend on dog behavior called How to Behave So Your Dog Behaves by Sophia Yin. She's a veterinary behaviorist, and I actually worked with her when I was up at UC Davis. And it has some really nice down-to-earth tips on how to help prevent certain dog behavior problems. I have the book on my table if you want to come check it out. Now I'm going to talk about spaying and neutering. You probably all are aware of the pet overpopulation crisis, which is claiming the lives of roughly 4 million dogs and cats every year in the United States. So it's clearly the responsible thing to do for that reason. But some people don't realize there are actually health benefits to the spaying and neutering surgeries. In the case of the female, it prevents mammary cancer, especially if done before the first heat cycle, which in a dog is generally between 6 to 12 months of age. And it also eliminates the risk of pregnancy, which can involve a lot of complications, including the need for a C-section, and also be quite expensive. And it also eliminates the risk for an infection of the uterus, which is called pyometra. And when that happens, there's also an extensive treatment needed, including the spay operation itself, to rescue that animal from that crisis situation. Another aspect of spaying that is helpful in preventing injuries is the fact that a dog who's spayed or neutered will be less likely to search for a mate because that drive will be diminished, and so there's less risk of getting hit by a car because the dog will be less likely to jump the fence or try to bolt out the gate. And so that's actually pretty significant, especially in males who are less likely to get into fights with other dogs and that sort of thing. Now, some of the health benefits that males have in addition to what I just mentioned is elimination of the risk of testicular cancer and also reduction in risks for prostate diseases. Now I'm going to talk a little bit about toxin exposure avoidance. There are basically, in my mind, 3 broad categories of toxins that animals can get into. One being human drugs or medications, and those can be given on purpose or inadvertently, by mistake. Someone may be taking their medication and drop a pill on the floor and not realize it, and then a dog comes along and swallows it up. And sometimes well-intentioned guardians may give a medication they think is helping when it actually causes harm. One example I had several years ago was a couple that gave their cat a Tylenol, and they thought the cat was in pain. That's why they gave the Tylenol, and the cat ended up dying of kidney failure. So it's really it's sad when that happens, and it's just important to realize that cats metabolize drugs very differently than people do. So don't give them Tylenol, don't give them anything unless you consult with a veterinarian or someone who's knowledgeable about that. Another category of toxin exposure is actual poisons. So some people use rat bait or snail bait in their yard, and those are actually fatal if ingested and if early treatment is not gotten in time. So snail bait causes life-threatening seizures and hyperthermia or elevated body temperature, and rat bait causes bleeding disorders. Another thing that I've seen animals get into are ethylene glycol, which is the active ingredient of antifreeze, and it's a car substance that's used. But if they get into that, it makes them get kidney failure. So keep all of those things far away, and just like a child, getting into things, dogs can get into things like you wouldn't believe. As far as the third category being plants, there are actually hundreds and hundreds of plants that are toxic to dogs and cats. And some of them include Easter lilies, which cause kidney failure if ingested by a cat, and potentially a dog as well. Chocolate, if consumed in excessive quantities, can be toxic, although as long as it's not too much, which is a dose-dependent phenomenon, it usually can be resolved with supportive care. Onions can cause anemia. Macadamia nuts also should not be fed. And if you want a full listing of toxic plants, I would recommend going to the ASPCA website. They have a comprehensive listing of plants that are toxic to dogs, cats, and horses. And they have the pictures of the plants along with the names, so you can look in your garden if you have any of those plants and make any needed adjustments. And there are a lot of non-toxic plants too, so you can definitely make a non-toxic garden so you can be at ease if your dog or cat is a plant muncher. Another concern that has to do with weather changes, especially in the summertime, is heat stroke and heat exhaustion. And I've definitely seen a lot of dogs suffer and die from that. So it's really important not to take your dog out in the middle of a hot day for a long hike. That's a common story that happens, and people just don't realize that dogs can't sweat the way people can to cool themselves off, and their bodies just cannot handle the excessive heat. So it's better to just take them early in the morning before it gets hot, or in the cool of the evening. Another thing that dogs have died from is being left in a hot car. And even just a few minutes being in a hot car can be enough to get them into a very critical state. And this definitely has caused dogs to die. So even if you're just going to run into the store for a minute, don't leave your dog in the car alone, because the temperature in a car on a hot day can reach life-threateningly high levels in a very short period of time. Another seasonal problem, which is not life-threatening but is a nuisance, is flea allergy. And that's actually the most common cause of skin allergy or dermatitis in dogs and cats. And it's very easily prevented just by using a monthly flea control product. So I recommend doing that. Now I'm going to talk a little bit about diet. And many of the commercially available dog and cat foods contain meat byproducts or slaughterhouse waste products, which basically are the parts of the meat that are not considered fit for human consumption. The disease part, sometimes there's trash and undesirable parts that are put into the pet food because there's no other economical use for them. And this has been implicated in the increased incidence of cancers that we've seen in our companion animals in recent years. So what I would recommend is either feed a vegetarian diet, which is actually a better option in more ways than one since we're not contributing to the slaughterhouse industry, or you can try and feed your own diet, but that tends to be more complicated. And there are a number of reputable vegan dog food companies, including one who's here today, V Dog Food. They have a booth, and they have a diet which meets all the nutritional requirements that dogs have. So for dogs to be vegan is really quite doable, and dogs can definitely thrive on that diet, provided it meets all their nutritional requirements. However, with cats, since they are naturally carnivorous, it's a lot trickier, and cats can definitely run into problems if they're on a vegan diet, if their urine becomes too alkaline, because the plant-based diet has an alkaline effect on their body, including their urine, and that tends to make them more susceptible to forming crystals, which can then lead to a life-threatening urinary blockage, especially in a male cat. So it's really crucial that if you try to get your cat to go vegan, you be extremely vigilant with monitoring their urine pH by taking them into the vet and getting that tested, and that you work closely with someone who has experience with this, because otherwise you could end up with a $2,000 vet bill and a sick cat, which is not fun. All right, well, I'm gonna open it up to questions now. Thank you very much for your attention. Does anyone have questions? Yes, right over there. Xylitol is dangerous. I would not have your dog eat that. That has caused some poisonings in dogs.
What is that?
It's an xylitol. The question was about xylitol. Xylitol is an artificial sweetener. Hi. Yes.
Your dog is, your dog looks like they're in pain, and it's like 10 o'clock at night. It doesn't seem like an emergency visit type of pain, but arthritic. Is there any kind of medication you can give a dog, like a quarter of a Tylenol or anything?
I wouldn't give Tylenol, but you can safely give aspirin at a dose of 10 to 15 milligrams per kilogram, and 1 kilogram equals 2.2 pounds. So basically, if your dog weighs like 40 pounds, that's about, okay, how much does your dog weigh? 70 pounds. Okay, so that's roughly 30 kilos. So you could safely give an adult aspirin to your dog. But make sure that your dog is not already on something like Rimadyl, which is also a non-steroidal anti-inflammatory that's specifically designed for dogs, because if the dog's on that, or if the dog's on prednisone, then it could cause gastrointestinal problems. So just make sure that there's no other medication the dog's on, such as prednisone or Rimadyl or Daramax, any of those anti-inflammatory medications that could be contraindicated with that. Anyone else? Jessica.
Do you have any suggestions for cats who are having problems using the litter box as they should?
The question is about cats using the litter box, and thank you for that, because I was going to mention that. That is actually a pretty common problem, and a guideline that I have is to have 1 litter box per cat plus 1 additional box. So if you have 1 cat, you should have 2 boxes. If you have 3 cats, you should have 4 boxes. And that's something that should be clean every day. And you may have to try out different types of litter if there's a specific aversion to that type of litter. One thing that can cause litter box aversion problems is actually decline, which is a misnomer in a way, because what it really involves is amputation of the last digit of the foot. And if not properly controlled with adequate pain relief medication, it can be quite painful, and in some cases even crippling if there's not a good healing process that ensues. And sometimes cats do develop litter box problems as a result of that, because they have trouble using the box. And in addition to that, there are alternatives, of course, to decline that are more effective, like training your cat to use a scratching post. And there are also these soft paws that can be glued onto the tips of the claws. So they're definitely humane alternatives to decline. Yes?
The flea treatment that you were talking about putting on the animal, it says how don't get this anywhere near your skin or anything. Are there any ones that are bad for your dog? Like, are they all okay? Like, the front line is.
Well, it depends on what you're aiming for, which product you use, and they're different. There are minor differences, but the revolution is to protect against fleas and worms, and then frontline, depending on if it's frontline or frontline plus. Frontline plus protects against ticks and fleas, and then just regular frontline just protects against fleas. So depending on the environment the dog's in, that would influence which product you choose. Or Advantage, they're just different chemicals, but I would try to not get it on your hands if you can avoid it, and make sure you don't bathe the dog 2 days before or 2 days after applying the product for maximal effectiveness, because the way the product works is by mixing with the oils of the skin, and then it distributes over the entire coat. And if you bathe them right before, then there won't be any oils in the skin. If you bathe them right after, it washes the product off.
It's not bad for the dog in any way.
As long as you're using it as directed, no, it should be fine. Yeah. And I might also mention there are a lot of other types of medicine besides Western medicine out there. There's homeopathy, acupuncture, chiropractic, herbology, flower essences. There are a lot of different techniques available. So Western medicine is really great for acute injuries and immediate crises, but when it comes to more chronic, long-term diseases, in some cases the alternative methods are more effective and less harsh on the body. JD.
My coworker has a kitten, like less than 1 year old. It has ear mite problems, and his wife has been cleaning the ears and doing medicine that the veterinarian gave him, but she's getting frustrated because the ear mites just won't go away. Do you have any recommendations for that?
Well, the question is about ear mites, and the medication is apparently not effective. I guess I would need to examine the cat and see if there's something underlying in the ear canal, or if the environment is predisposing to that, or if there's some immune problem the cat has that's kind of underlying that's contributing to that. In some cases, if an animal has a weak immune system, there can be a harder time to counteract these different infections.
Does vacuuming help get rid of ear mite larvae and eggs like it does with fleas, or do they live entirely on the animal?
Vacuuming is a good idea in general. Whether it's going to help with that specifically, it's hard to say. But certainly with inhalant allergies, like sneezing and coughing, vacuuming and also having an air filter is a good idea. Anything else?
I was told that, on using Rimadyl for a long period of time can be damaging to the liver, and that there's an alternative that's just as good as Rimadyl. I forget the name of it.
So the question's about Rimadyl, and that's probably the most common anti-inflammatory, and it has the potential to cause liver problems. So that's why any dog who is on Rimadyl should have his or her liver values monitored 3 weeks after starting, ideally, and then again a year later to make sure there's no problem there. And also any side effects involving the gastrointestinal tract should be monitored. One of the alternatives to Rimadyl is acupuncture, which has been shown to be very effective in providing pain relief for arthritis and other musculoskeletal problems. As far as medications, there are other non-steroidal anti-inflammatories, and a particular dog may have a better time on one of the other medications, but they're all pretty much just variations on a theme. They're all in the same class of drugs.
Equally damaging to the liver.
Not necessarily equally damaging to the liver, but there may be other side effects that occur. And for some dogs, they do well on one non-steroidal and not so well on another. So sometimes it's just that drug is just not the right drug for that particular dog. But I think acupuncture is definitely worth trying. I've had some good success with it. Sure. All right, well, if there's anyone else, feel free to ask. Otherwise, thank you very much. And if you have any questions that you think of later, you can email me. My email address is veganvet@gmail.com. You can also check out my website, which is drmayvethousecalls.com, and I have another one, which is veganvet.net. Thank you very much.
Thank you very much, Dr. May. As she said, Dr. May has a booth here at WorldFest, so if you have any questions or if you want to learn more about her practice, you can check it out. And I can do a little plug for her because my cat does see Dr. May as his vet, and what he really loves is not having to go in his cat carrier in the car. She comes to him, and for my cat, that is a tremendous benefit.